A common symptom that people may have if they have dysfunctional fascia, if the fascia is really tight, is just a sensation of tightness in the area. And the funny thing is, with this type of tightness, no matter how much the person stretches, the person will not feel that the muscles have loosened up. It's not until they get on the table, get some treatment done on that particular area that seems to be tight, even though the person's flexibility seems to be quite good, that they'll notice a difference in the way that their tissues feel whenever they stretch. Another common one that I've seen is chronic pain. So somebody that might have chronic pain of the lower back, for example, maybe the neck, I might notice that when they're on the table that their fascia is very, very tight. As soon as the fascia is loosened up, they notice a big difference in the way that their lower back may feel or their neck may. The funny thing about fascia is that it's a very adaptable type of tissue. It adapts quite well and sometimes too well. An example of this is posture. So if you're sitting in front of the computer for prolonged periods, where you're rounding your shoulders, your head's forward, you're slumping like so, what will happen is not only will your muscles become tight, but the connective tissue often adjusts to the position that you're in, and depending on how long you've been in that position, it can be quite tight, particularly on the chest, shoulders, neck area, and at the abdominal area. So what this person may feel is that they get pain around the mid-back, pain in the lower back. But what I found during treatment is that if I release this area first, there tends to be better results in regards to pain in the mid-back, pain in the lower back, and also in the shoulders. So in regards to nerves and muscles, what happens is when the fascia becomes very tight, anything that becomes tight around the area, anything that becomes adhered tissues, when I say adhered, I literally mean that the tissues get stuck together. That could mean that the tissue such as nerves can also stick to the fascia, or the fascia can stick to it. What will happen is that nerve becomes more irritated, causing potential spasm of muscles in the area and causing pain. That's the link between fascia and nerves and muscles. A common presentation that I've seen in regards to breathing difficulties. So for example, somebody that might have issues with, maybe they feel like they're not getting enough air, they feel like their chest may be more compressed, it's harder for them to breathe, is tightness of fascia around the chest region and also like the abdominal region. So this person may be an asthmatic, this person might be suffering from lower back pain and not realize that there's a lot of tightness of the connective tissue in the area around the chest and the abdominal area that could be causing some of the lower back pain. As soon as this is released, the fascia in the front, they'll notice a big difference in the way the lower back feels and also the way they breathe. Okay, so insofar as swelling and what the fascia, what can happen when there's tight fascia, if you can visualize, tightness around, say for example, the wrist. A person has swelling in the wrist, and there's tightness of the tissues there. Generally, there should be good flow in regards to the movement of the swelling. But unfortunately, what happens is if there's really tight fascia, it can cause pockets of swelling to stay there, causing pain in the area. So the basic premise for the treatment for somebody that may have swelling in the area is to release the fascia around the swelling. When the fascia is released, it's a lot easier for the fluid to move. Therefore, there'll be less pressure in the area, less irritation of the nerves, causing the pain and the dysfunction. Sometimes what will happen is when somebody has a scar from a surgery or potentially from a trauma to a particular area in their body, that scar can actually pull on connective tissue. That pulling can cause an irritation in the area, potentially irritating nerves, causing pain because of the irritation of the nerves, spasming, there could be swelling in the area. Scar tissue can do a lot of things, and it can cause the connective tissue, the fascia, to become even more tight. Here's the thing about fascia. What happens is if it's a very chronic condition, patients can do exercises over time, but they'll find that there's not much of a change. And generally what that means is that that person needs to come in and get treatment and get it manually worked on. So what I generally do is I use my hands to basically go into the tissues and I try to loosen up the fascia. And yes, as mentioned in part one, it can be painful depending on how chronic the issue is, but it is very, very effective. I've done this for about 16 years or so, and I've had patients tell me some wonderful things when they come off the table. They feel a lot looser, they feel that there's more blood flow, they feel a lot lighter, there's obviously a decrease in pain, potentially a decrease in swelling, so on and so forth. So what I've actually seen is people who have tight gluteal or hip muscles. I've seen a lot of tightness around the outside of the ankle. And what I do is I release the fascia, the connective tissue around the outside of the ankle, and what happens is that the glute muscles actually release and relax. It's actually a lot easier for me to do that than to say stick an elbow in the glute or my hand, working manually specifically to that local area. So I've seen some wonderful things working further down to release other areas that are further up the chain.